And they determined she had autism. And then we began trying to deal with autism. From the medical profession, what they'd like for you to do is simply treat the symptoms. They don't want to cure it, they don't want to fix it, they just want you to deal with autism. Well, I didn't like that answer.
So she put us on the Popeye protocol, and I would say within weeks, not even weeks, maybe a week or so, Hannah was different.
And within 3 days, one night, he just came out and he sat by us and he's like, I just came to watch TV with you guys, and we were just amazed because that never happened. No matter how much we asked him, we would ask him and he would come out, but then he would go back. And so it just got better from there.
Dahlia, almost immediately. I would say within a week or two, you could tell.
Within a month, we could tell a huge difference in her behavior. It was as if a veil had been lifted.
The most recent estimates indicate that a staggering 1 out of every 150 children in the United States are now being diagnosed with some form of condition within the autism disorder spectrum. Countless more children every year are being labeled and treated for ADD, ADHD, sensory integration disorder, and other similar conditions that negatively affect their behavioral, social, and learning skills. Despite these appalling and ever-escalating statistics, the prevailing wisdom is that there is no known cause, no effective treatment, and no cure for autism and these related conditions. But not everyone is willing to remain within the confines of this limiting sentence.
Those two things consumed like a little box. But after this, it's like the box burst and I came out.
What if in reality, one of the answers to a problem that is perceived as so complex could be so simple that a child could do it?
I call it my program.
The amazing children that you just saw in this video are just a few of the kids that have gone successfully through our dietary and supplemental protocol that we're using aimed at the symptoms of autism and other syndromes within the autism-related spectrum like ADD, ADHD, or sensory integration behavioral problems. The amazing, impactful, incredible results that we've seen with these kids are due to diet and supplements and to the care and diligence of the parents, not because of some drug treatment or an expensive therapeutic protocol. Diet. Now, when you're using food and you're using dietary supplements, the other upside of this, besides being inexpensive, is that it is non-toxic. It is very, very simple to do because it's all just food.
I noticed she was different at about 2.5. She would be in another world. At times she would shut down, and you could just see that the lights were on, but nobody was really home. She was distant, and she would go to another place.
They called Dahlia a vacuum, that she would suck the energy from the room, and all the kids would be looking at her instead of at the teacher.
Pretty much in kindergarten, there were signs of focus problems. She couldn't focus.
In trouble every day.
And his teachers would really complain about his behavior, his lack of attention, his disruption in the classroom. And most of the teachers just chalked it up to he was just being bad.
She also fixated on things and needed routine desperately. If we were traveling down the road and she thought we were supposed to turn left and we went straight, she had a fit. She would go crazy.
She always said, it hurts to sit still. I can't be still, because I was always telling her, be still. You know, fold your hands in your lap, be still. And she couldn't do it. It was driving her crazy. It was driving everybody crazy.
I always called her my Twitter bug because I couldn't even get her to put on shoes without getting distracted for something else.
if we ever went to my dad's friend's house, I'd say, "Can I go home?" like after 30 minutes.
She would separate herself from people on purpose.
So I just like to stay by myself. And the classrooms were pretty empty during recess, so.
She was at first said to have a communication and behavioral problem. And then they did an assessment on her, which was very difficult. Ray couldn't, at that time, even respond to the questions, even if she knew the answers.
And he always complained everybody was disrupting him. Everybody was too loud, too loud. I went to his classrooms and they were never disruptive. They were quiet, but to him, that's not what it was.
In the first grade, there was a lot of difficulty. Second grade, it was horrendous. I mean, she would come home crying every day from school because she wouldn't get work done and the teachers were angry and very frustrated.
The first thing we tried was a gluten-free diet, which is very difficult to do, as you know, especially with a little kid, especially with an autistic little kid who's very picky in their diet.
And they put him on Medidate, I believe is what it was called. That worked really well, except for he couldn't sleep at night. And then they put him on Ritalin, and it wasn't enough, so they bumped him to a higher dose of Ritalin, and he became very mean.
They just said we need to go to counseling and get her assessed, maybe take some parenting classes, something to help us. So we started doing that.
And the gluten-free diet was really difficult, but we gave it a good 6 months, and there was very little change in her behavior.
And the doctor wanted to put her on Adderall, and I just, Hannah's father's family has a lot of history of alcohol abuse and addiction, and I wasn't willing to gamble with that for her.
So we brought her in, put her on the protocol, the Popeye protocol. I thought she wasn't going to respond, or it would be difficult to do because of her difficulty with foods. She only liked white foods. She only liked some textures she didn't like. So we called them her special shakes, put them on her special shakes twice a day, and she sucked them right down like a sponge. She didn't eat chips anymore. She sat there and ate a little baggie full of spinach leaves and loved it. Mom, can I have more leaves? More leaves. At that point, she couldn't even complete a sentence. It was more leaves, more leaves. And we're like, okay, here you go. Everything we gave her, she loved, absolutely loved. It was as if her body craved it.